Dr. Walter Freeman II, a respected neurologist, practiced lobotomies for over 3 decades. His technique, using an ice pick-like instrument plunged through the eye socket, directly into the brain. Patients were fully conscious during the procedure, experiencing excruciating pain and lasting psychological trauma. Freeman performed thousands of these surgeries, many without informed consent, between the 1930s and 1960s. Dr. Walter Freeman was a respected neurosurgeon practicing in the United States during the mid-20th century. From the 1930s to the 1960s, he performed over 3,500 lobotomy, a radical procedure intended to treat severe mental illness by severing connections in the brain's prefrontal cortex. Freeman believed his technique, using an ice pick-like instrument inserted through the eye socket, was quicker and less invasive than traditional methods. But there were whispers, concerns raised about the ethics and efficacy of his procedures. Patients reported excruciating pain during the conscious surgeries. Families noticed drastic personality changes, a chilling loss of individuality in their loved ones. Yet Freeman continued, undeterred, operating on over 3,500 patients across the country. From the late 1960s to the mid-1990s, a horrifying truth unfolded within the sterile walls of Dr. Walter Freeman's practice. He wasn't just performing lobotomies, he was doing so on fully conscious patients. Over 3 decades, countless individuals underwent this barbaric procedure without anesthesia or even adequate pain management. Among them were Alice Hamill, a 35-year-old mother of 2, struggling with postpartum depression; John Davis, a 21-year-old aspiring artist battling anxiety and self-doubt; and Margaret Johnson, a 48-year-old schoolteacher suffering from chronic fatigue. They each sought relief, hoping for a brighter future. Freeman's treatment stole not just their sanity, but their very ability to live fulfilling lives.
Eye socket into their brain. Dr. Walter Todd practiced medicine in rural Georgia from the 1920s to the 1950s. For over 3 decades, he treated patients with a horrifying secret method: no anesthesia for any procedure. His Scrooge echo technique involved crude restraints and unwavering belief in his own pain tolerance. Todd claimed patients felt less due to shock, but documented accounts tell a different story. Screams echoed through his operating room. Patients reported agonizing memories long after their surgeries. How did this continue for so long? The answer lies buried deep within the social fabric of Todd's time and place. Dr. Harvey Cushing's surgical prowess was renowned. He pioneered innovative techniques, performed groundbreaking surgeries at the Peter Bent Brigham Hospital in Boston, and authored influential medical texts. But hidden beneath his celebrated career lay a chilling secret. For decades, Cushing operated on patients while they were fully conscious. This horrifying practice, exposed only after Cushing's death in 1939, left countless victims enduring unimaginable pain during procedures. How did he get away with it for so long? Cushing meticulously destroyed patient records, ensuring no trace of his conscious surgeries remained. He wielded influence and wealth to bribe hospital officials, turning a blind eye to the screams echoing from his operating room. And those who dared to speak out, patients left scarred physically and emotionally, were silenced through threats and intimidation. Dr. Walter Freeman II, a neurosurgeon known for his radical lobotomy technique, practiced for decades without raising significant alarm bells. His methods were controversial even in the mid-20th century, but Freeman remained influential within certain circles. He traveled extensively, performing his procedure on patients suffering from a range of mental illnesses. One such patient was witness one name, who underwent Freeman's lobotomy in year. Dr. Walter Freeman II, a pioneering neurosurgeon, believed he held the key to treating debilitating mental illness.
Amassed considerable wealth during his career. Exactly how much he profited from this ethically dubious practice remains a chilling mystery. Irold Lawson was just 27 in 1968 when he sought treatment for chronic stomach pain from Dr. John Green at the University Hospital in Cincinnati. Green diagnosed Lawson with peptic ulcers and recommended surgery. Lawson agreed. He remembers waking up on the operating table, strapped down, but feeling everything. The searing pain of the incision, the tugging and pulling. Lawson screamed, begged for Green to stop, but his pleas were met with indifference. The surgery lasted 3 hours. Green never administered anesthesia. Lawsuits followed. Patient after patient stepped forward with chillingly similar stories. Conscious during surgery, enduring unimaginable agony under Green's blade. For 3 decades, Dr. Walter Freeman conducted lobotomies, a radical procedure severing connections in the brain's prefrontal cortex. His patients were conscious during these operations. Freeman justified his methods, claiming they alleviated mental illness. But whispers of dissent arose early on. In 1942, Dr. John Fulton, a colleague at the George Washington University Medical School, voiced concerns about Freeman's unorthodox techniques and lack of proper anesthesia. He warned that Freeman's procedures were crude and potentially dangerous. Yet these warnings went unheeded. In 1946, journalist William S. Burroughs published an exposé in the New York Times Magazine detailing the harrowing experiences of patients subjected to Freeman's lobotomies. Burroughs described them as being left with permanent cognitive impairments, emotional flatness, and a loss of personality. Despite this damning evidence, Freeman continued his practice unabated for another 2 decades. For 3 decades, Dr. Robert Liston thrived. His speed and ruthlessness were legendary. Amputations performed in mere seconds. But behind the spectacle lurked a horrifying truth. Liston operated on conscious patients. No anesthesia, no pain relief. His victims writhed, screamed, begged for mercy, but Liston pressed on, driven by his ego.
Crimes shocked even seasoned law enforcement officials. Faced with overwhelming evidence, Callister was arrested and charged with multiple counts of aggravated assault, battery, and medical malpractice. Dr. Walter Freeman II conducted lobotomies on thousands of patients, including those diagnosed with depression, anxiety, and even epilepsy. He believed this procedure, severing connections in the prefrontal cortex, could alleviate mental distress. But these surgeries were often performed while patients were fully conscious. Freeman continued his gruesome practice for decades. From 1936 to 1967, his technique, using an ice pick-like instrument inserted through the eye socket, became infamous. Despite mounting evidence of its brutality and ineffectiveness, Freeman faced minimal consequences. The medical community largely turned a blind eye. From the late 19th century through the first half of the 20th, Dr. Walter Freeman performed thousands of lobotomies, a procedure involving severing connections in the prefrontal cortex. But unlike modern neurosurgery, his method was crude and brutal. He often operated on conscious patients, using ice picks inserted through their eye sockets. Remarkably, Freeman continued this practice for over 3 decades, operating on individuals ranging from the mentally ill to troubled adolescents. The question arises, how could such a barbaric practice endure for so long? From 1946 to 1975, Dr. John B. Harris practiced surgery at a public hospital in rural Virginia. But Harris's methods were anything but standard. He performed major surgeries on patients while they were fully conscious. No anesthesia. This went undetected for 3 decades. The question arises, how could such horrifying practices persist for so long? The answer may lie in the silence of those who knew. Nurses, aides, and even other doctors witnessed Harris's operations. Some claimed ignorance.
Later, they would be formally refuted. An isolated incident, the Mercy Hospital Board declared in a 2010 statement. Dr. Wilson's surgical practices were within accepted medical standards at the time.